We have several ways to treat female pattern hair loss. Of course, topical minoxidil is the number one recommended treatment. That's Rogaine. It comes in a solution or a foam. However, the reason most of my patients don't do that or don't continue doing that is it's a little bit of a hassle. And also, if you stop it, you lose it all again. So it's very frustrating for people to take a break from that and then lose all the hair that they had gained. But that is the number one treatment recommendation medically. Off label, we have some other recommendations. Oral minoxidil is off label for this treatment, but it also has that downfall that if you stop, your hair falls back out. Other off-label treatments are spironolactone pill that we use for hair loss in an off-label manner. You really should have your blood drawn before and after you've been on that treatment. It can dehydrate you, affect the kidneys, change your potassium levels. So as an internal medicine physician, I get very frustrated when I see that prescription being written for acne or hair loss and not having blood work checked, because that can be a potential danger. Propecia or finasteride has absolutely zero evidence in women that there is improvement in hair loss. It is used off label sometimes, but the evidence is not there for women. Then there's things like the low level laser light therapies, like the caps that you can wear, and products that improve the health of the scalp, but they can be expensive, and there is some data, but not overly impressive data. We can improve the health of the scalp by injecting PRP into the scalp, which can be pretty painful, or it can be lasered into the scalp. We have lots of success with is not PRP, but we do a low level laser with an actual laser, which in and of itself dramatically improves scalp health, and you can see improvement from that alone. However, we ramp that up by applying topical product on top of the laser treated scalp at the time of the treatment. And that is our liquid PDO, which we just started offering for that. And it does have good data to show improvement, as well as PDRN. And you may have heard of that as the salmon DNA. And so it really stimulates those hair follicles and helps to grow hair.